Usually spasticity tends to get worse over the first year of injury. After 1 year of injury, it tends to stay stable. There are things that will make it worse and things that will make it better, and it's important to try and differentiate whether or not the spasticity is evolving due to its natural history or due to an underlying medical condition. Typically with a natural history, spasticity will increase slowly over time. It won't be a sudden change. If there's a sudden change in the spasticity over a short period of time, it really makes you think about why is the spasticity getting worse. In spinal cord injury, there's some very common triggers for spasticity, but bladder is the most frequent. The reason for that is that individuals with spinal cord injury develop what's called a neurogenic bladder, which is essentially the bladder and the sphincter that are no longer under control of the centers above the spinal cord. For example, checking the catheter, if you have an indwelling catheter, is the number one thing. It's the easiest thing to do, and often that's the problem. Checking for a urinary tract infection, that is a very frequent problem of increasing spasticity within a short period of time. And if those things aren't positive, then looking for things like the stones with appropriate imaging would be a very reasonable next step as well. The same thing happens with the bowel. You develop a neurogenic bowel, so a bowel that's no longer under control of the central nervous system as it was before, so you're relying on its intrinsic reflexes. So you tend to get constipation, hemorrhoids, fecal impaction, and those things can certainly trigger or aggravate spasticity as well. Because individuals with spinal cord injury lack the mobility that they used to, the sensation that they used to, and there's other factors that impair wound healing, they tend to have problems with skin breakdown, so pressure ulcers, but even something like an ingrown toenail or an undetected fracture, those things can trigger spasticity. So you may treat the spasms in the meantime while you're looking for the triggers, but in the end, what's really going to treat the spasticity is finding out why it happened in the first place.